The healthcare sector has wiped out much of its losses for the year during the December market rally. Beaten down biotech and medical device makers have seen the biggest rebound this month, and analysts see that momentum continuing in the new year. Still, analysts and strategists have a mixed outlook for the sector in 2024. "We're entering the year as an underweight," said Sam Stovall, chief investment strategist at CFRA. "There's a lot of overhead resistance, and they have to work through that overhead resistance because a lot of investors might say, 'Let me get out and move on to something that has better growth potential.'" The second week of January could bring some big moves for healthcare names, when companies present at this year's J.P. Morgan Healthcare Conference in San Francisco. It is one of the year's largest healthcare gatherings of major industry CEOs, and companies often provide updates on earnings guidance and clinical trial research during the conference. The political calendar could pose one of the biggest challenges. The S&P 500 healthcare sector has lagged the S&P 500 in 4 of the last 6 presidential cycles. Increased regulatory focus on drug prices could result in another year of underperformance. The S&P 500 healthcare sector remains on pace for a second straight annual loss, dragged down by COVID vaccine makers Moderna and Pfizer, which have fallen more than 40% for the year. Eli Lilly, up more than 55% for the year, is the sector's biggest gainer, fueled by demand for its diabetes and obesity drugs. Here's a look at which parts of the health industry analysts see facing continued pressure in 2024, which will get some relief, and which beaten-down names are getting investors' votes for a rebound next year. In 2024, Inflation Reduction Act drug price negotiations will be front and center. Medicare officials will make their initial offers on the first 10 drugs chosen for discussions February 1. This law was passed, and we want to implement it in the most thoughtful manner possible, said Dr. Meena Seshamani, Deputy Administrator and Director of the Federal Center for Medicare, to really create a robust conversation in our health system in a sense that, how can we ensure access to innovative therapies that people need? The drug makers have sued the administration but have chosen to proceed with discussions, while complaining that negotiations in this country will be different from those they've had with other nations. They argue that U.S. health insurers and pharmacy benefit managers may not pass on full discounts to patients. In a European market, when you negotiate a price, that medicine is readily available to patients. There's no prior authorizations, said Victor Bulto, president of Novartis U.S. operations. Novartis heart medication Entresto is among the first drugs selected for negotiation. Approved by the FDA in 2015, the negotiated Medicare discount on the drug will go into effect in 2026.